Let's begin with that health story. And Kenyans have been warned to brace themselves for a very painful December holiday and Christmas period and to expect a total shutdown of the public health sector. Doctors have declared that they will go on strike on the 5th of December at the end of their legal notice. This is to protest what they say is a refusal by the Salaries and Remuneration Commission and the Health Ministry to take seriously their demand for a 300% pay rise, even after a court ruling in their favour. Timothy Otieno begins our newscast tonight with that story.
Just a day after the Salaries and Remuneration Commission and the head of the public service announced new structures to guide how public servants in various sectors will be paid, solidarity forever, doctors have come out to oppose that move, insisting their voice in the matter has not been heard. For the union makes us strong. Citing a June 2013 collective bargaining agreement between the Doctors' Union and the Ministry of Health that they say has simply been ignored in the latest reviews.
We as a Doctors' Union, having negotiated, having been in a process for the last 3 years in a collective bargaining agreement, know what those figures are. And before you hear are what we call consensus proposals. This was signed by the government.
The consensus proposals, they say, would allow the basic salaries of doctors in Kenya to go up by 300%. Currently, the basic salary of a Job Group L medical practitioner stands at 35,910 shillings. The collective bargaining agreement was to shift that salary upwards to about 121,910. A court ruling dated 6th October this year did uphold a decision to have the doctors receive the pay hike, but nearly a month after that ruling, nothing has been forthcoming. The doctors issuing a 21-day strike notice insist if their demands are not met, they shall paralyze health services countrywide.
On the 5th of December 2016, if these figures will not be paid for doctors, if the Salaries and Remuneration Commission, the Ministry of Health, the county governments, Kenyatta National Hospital, MTRH, and every single program where doctors work at the public sector will not agree as the court demanded, will not agree as we agreed and signed then to pay doctors these amounts of money, which equates to 300% salary increase, we shall proceed on a national strike.
And this time round, we are not joking. Tumeamua daktari lazima alipwe pesa yake.
In a statement to KTN News, the Salaries and Remuneration Commission, however, insists that Friday's announcement for the job reviews does not mean that the Commission had halted any salary talks and that the announcement was just to guide job grading. But the doctors' argument seems to be based on the fact that the Salaries and Remuneration Commission evaluation did not affect teachers, ostensibly because there's already a collective bargaining agreement between the teachers' unions and their employer, the Teachers' Service Commission. Doctors wonder why their deal is not being honored as well.
Why are they not telling us how much we should be able to earn? Because even SRC is ashamed of how much this country is paying their doctors.
The conclusion of the job evaluation exercise for more than 600,000 public servants in Kenya was meant to, among other things, seek to bridge the gap between the highest and lowest pay earners. The doctors' strike threat, if realized, could see Kenyans experience a rather painful December holidays as the fate of medical services in the country hangs in the balance with yet another looming tussle between doctors and the salaries regulatory body. The end of a 17-month-long job evaluation exercise by the Salaries and Remuneration Commission could possibly be the kickstart of another health crisis in the country if the doctors' demands are not met. Question is, which side of the divide will give in first? Timothy Otieno, KTN News.